So the CDC's report, Joyce, shows that the pandemic has created what they call traumatic stressors that have the potential to further erode students' mental well-being. Now, we spoke with a psychologist at the University of Washington who says schools and parents, they can work to support kids and check in on their mental health.
The CDC said the findings released in its report echo a call for help. It found pandemic isolation, school closures, and a lack of gatherings took a toll on young people's mental well-being. 44% of the nearly 8,000 participants say they persistently felt sad or hopeless. 66% found it more difficult to complete schoolwork.
It's the opportunities to make decisions when you're emotionally frustrated. And it's the opportunities to celebrate with each other when you're emotionally happy, right? And so we miss some of those things.
Jim Mazza is a psychology professor at the University of Washington, focused on kids' social and emotional needs.
We're taking away one of the major supports that kids have, which is each other.
The report called schools crucial partners in supporting the health and well-being of students. Mazza says teachers are now seeing the effects the pandemic had on kids not being in the classroom.
You know, they lost a year, 2 years of socialization. They lost 2 years of development and opportunities to learn. They lost opportunities to make mistakes. They lost opportunities to kind of grow that way. And so I think that we're at a spot where we've got, you know, freshmen and sophomores in high school right now that really are in that 7th to 8th grade type of level, maturity-wise.
The CDC believes surrounding students with support can help reduce the trauma from the pandemic. Mazza says this is an opportunity for schools to start teaching kids about coping tools and having an open conversation about mental health.
We know our kids are growing up in a different life right now, especially with social media. We need to be teaching them skills and decision-making about what to do, what not to do. And then in the face of emotional difficulty and emotional pain, what can I do that's not self-harming, that's not self-medicating, that's not suicidal?
So Mazza said it is not just schools, parents also play a role, but he did acknowledge a lot of parents aren't taught the skills to support their child's mental health, especially if their parents weren't taught in their own schooling about mental health. So he did say there's an opportunity for education all around, but something simple that parents can do is they can check in on their kids, ask them how they're feeling, and encourage them to spend time with friends in person and not through a screen. Back to you.